Good afternoon, my friends. The doctor is in the house, and welcome back to another episode of To Your Health with Dr. G. My name is Dr. Mark Gomez. I'm a board-certified internal medicine physician practicing out of Edward Hospital in Naperville, Illinois. And I'm excited to welcome you all to our Countdown to Summer series. Now, it isn't summer yet, but it will be soon. And so over the next 4 weeks, we're going to be talking about awesome topics that are going to get you ready for summer and keep your health going nice and strong. Today we're going to be talking about preventing injury. Before I introduce my guests, I really think this topic is really important because this is our opportunity. If we've been kind of dealing with winter and transitioning through spring, but this is the time to really take advantage of the opportunity that lies ahead. A time to just rededicate yourself to health and general well-being. So today on the show, we're going to try to break this concept down. How do we prevent injury, and what can we do to continue to stay active and healthy in our daily lives? And this doesn't just apply to summertime. We want this to apply to all year long. So before we get into everything, I want to do a couple quick shout outs. Number one, my guest in a few moments, but I want to also thank our sponsor today. Our sponsor is Midwest Sports Medicine. You can check them out at www.gomidwestsports.com. So we thank them for their support and really excited to bring you this content. We have an amazing group of panelists today that are experts in their own unique way and really going to kind of give us a breakdown from their perspective on how best to prevent injury. So before we get into the show, I want to hit you guys with a quick disclaimer as usual. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So again, welcome back to the show, everybody. For our new listeners out there and those of us that are new on Facebook Live, what I try to do each week is I come with a great topic that we're going to talk about, but I try to really engage my professional healthcare network of experts to really give us further insights into the topics that we're going to be discussing. So again, today we've got a great group of panelists to talk about how best we can go ahead and prevent injury and hopefully enjoy your summertime. So my guest today, my first guest sitting to my right is Dr. David Burt. And Dr. Burt is a board-certified orthopedic surgeon. He's also the founder and owner of Midwest Sports Medicine, www.gomidwestsports.com. I've known Dr. Burt for since I first started in 2007 in my medical practice. Dr. Burt was one of the first doctors that I met and really developed a nice relationship. Turns out that he lived down the street eventually from me and my wife, so that always made it convenient. And but I've known Dr. Burt for 11 years now, and not only is he a good friend of mine, but he's also an excellent orthopedic surgeon. He's got tremendous bedside manner, and he's really helped our patients really recover aspects of their functionality. So, Dr. Burt, welcome to the show, and please just tell us a little bit about yourself, where you trained, and what kind of your take on how do you best prevent injury?
Thanks, Mark. I was just going to ask you to keep going because that sounded pretty good there, what you were saying. Maybe we should just continue.
Anytime.
I did my medical school in Nebraska, which is my hometown, or my home state, and did orthopedic residency in San Antonio. And then I did a sports medicine fellowship in Birmingham, Alabama. After that, in 2004, I came to Illinois to start practice here. And I was with the group for a period of time and then started my own practice in 2007, actually, right around the time that we first met. So, sports medicine primarily, and I do a lot of knee and shoulder surgery, and I see a variety of other injuries.
Excellent. Well, thanks, Dr. Burt, for coming out to the show. My next guest, she and I recently connected, but she's seen a ton of my patients over the years, and so I want to welcome to the show a good colleague of mine and excellent physical therapist, Ms. Natalie Florio, who's a physical therapist at Edward Elmer's Healthcare, www.eehealth.org. Natalie, welcome to the show. I'm so excited to get you on here.
Thank you.
And I reached out to Natalie in the planning of the show, and I was like, I need somebody that's dynamic, and that's going to just really speak with a passion. And of course, that is Natalie. She's had a ton of clinical experience. So Natalie, welcome to the show. Tell us a little bit about yourself, some of your training background, where you did your schooling, and kind of your approach to the topic of today.
Well, I went to Benedictine University undergrad, and then received a second bachelor's at Northern Illinois University, and then my master's at Northern Illinois University. I've been with Edwards since 2006. A little intern, I was gone, but basically been there since. I think and I thank you for having us, because I think most of the time we all see patients after injuries. That's what we're seeing. So this is such a nice opportunity to be able to talk and talk about the prevention of not having to see as many people during the summer. But I think, and we'll get more into it later, I'm sure, just having a good rounded group of having, flexibility, body mechanics, strengthening, cardio, all those things combined, as we get more discussion today, will help, of course, help prevent injury this summertime. We get active.
Excellent. Thanks again, Natalie, for coming on to the show. And my last guest on the panel today is Dr. John Artis. Dr. Artis is a board-certified chiropractic physician and co-founder of Health on Earth Wellness Centers. You can check them out at www.healthonearth.org. John and I, we actually met at a health fair probably about 5 or 6 years ago, and connected ever since. We originally met at a church in Bolingbrook on a Saturday morning trying to do a health fair, and you were out there and I was out there, and then we just kind of connected. This is a long time ago. We both have aged a little bit, but aged gracefully. And so Dr. Artis and I connected ever since, and he's an excellent chiropractic physician. So I wanted to get another perspective on today's topic by having Dr. Artis on the show. So welcome, Dr. Artis. Tell us a little bit about your background, where you trained at, and a little bit on the topic of today.
I'm originally born and raised in North Carolina. Went to North Carolina A&T State University with a degree in laboratory animal science and biology. And then I went to Palmer College of Chiropractic in Davenport, Iowa. That was just an experience in itself. So I graduated from there and went into private practice immediately afterwards and opened Health on Earth. And we grew up to 4 offices at one time. What I specialize in the most is like biomechanics. Posture is very key. And when posture is out, like how you put more wear and tear on your joints, and you can really destroy them. So that's what I like to bring to the table today.
Excellent. Thanks, Dr. Artis, for coming out. So again, we've got a great group of experts today that really have an interesting take and perspective on preventing injury. We all see things in different phases of injury. Now that we're out, and it's going to be summertime soon, that we're talking about countdown to summertime equals countdown to healthy time, as I like to call it. But we do see injury in various capacities. Certainly as a primary care physician, one of the most common things I see are people coming in with knee pain, back pain, and shoulder pain. And I'm going to have the other guests talk about some of the things that they commonly see. So certainly as a primary care physician, I'm on the first line of defense, so to speak. And it's my job at that point to really assess the person that comes in and kind of direct them to the appropriate care, whether I direct them to physical therapy or chiropractic or orthopedic surgery. It really comes down to the uniqueness of the patient, but also what they're presenting at. So as we're getting outside, it's warmer now. I want to ask this to Dr. Burt. I'm going to give him the first question. And we're getting warmer outside. People are trying to become more active. We got a little more time back on our schedules for those of us that have some flexibility in our schedules. The kids are out of school. So what's kind of if somebody's been kind of holed up in the wintertime, they want to start to get active again, what's the kind of first thing you're looking at to get people to get active without preventing injury?
I think the key for everybody, especially for adults that have been inactive over the winter or even the spring, is to start slow. Too many people try to get out there and go full speed ahead too quickly, too soon, and that's generally where we see a lot of injuries, because I see an enormous amount of patients that have been inactive over the winter months. They're very motivated now. They want to get out and do a very aggressive type of exercise routine so they can either get back in shape, lose weight, or whatever they're looking for. But they sometimes jump the gun and they get too aggressive too soon, and that's where we start to see the injuries. And that can be the intensity of what they're doing, or the frequency of what they're doing, or even the quality of the type of exercise that they're doing. All of those parameters, they should start slower, or people should start slower. and gradually increase so that they're not just going for broke right away.
Excellent. I know one of the things that I was talking about from a primary care perspective is know your limits. You can't go from doing nothing to doing a ton of things overnight, and it takes time. The human body has to adapt, and you're right. You don't want to do too much and kind of jump out of the out of the gates to start out, and then next thing you know, you're risk for injury. I know from a primary care perspective, one of the things that I look into is the person healthy enough to just exercise? And kind of the things that I always talk about is, number one, it always starts out with a basic medical assessment, and I can't stress that enough, that I want people to come in and see me to say, hey, Dr. G, check out my overall health, because maybe I want to do that kind of an exercise kind of routine. But I always tell people, you gotta make sure you're doing all right from a general health standpoint. So we want to look at things like nutrition, look at some of their goals, and really personalize an approach. But I always say, first things first, make sure you're not dying before you can start living. So Natalie, let me ask you this: when you're seeing people, because of course I tend to send some people your way and everything, but when you're seeing people are usually already injured at that point. If you have to kind of like advise them over again to say, all right, you're here now with this injury, but what could you have done beforehand? What are some kind of things that you talk about for preventing further injury?
Yeah, and I agree with Dr. Burt. A lot of them just go too hard, too fast. And also mixing up, you can't just start running and do these high impact exercises where you're really putting a lot of strain on the joints. Maybe you're a little overweight and you're going to add more weight to those joints. You should be able to mix in some lower impact. So yoga, swimming, biking, so making sure you get a good mix. And then I always bring up footwear as well with patients. I think that's really important. If you're going to start a new program, make sure you have the proper footwear. And that you're switching out shoes, and you don't have shoes from 1982 that you're still wearing, right? So I mean we see that a lot with ankle injuries and knees, and you don't even the shock absorption correctly on your feet. So that's a big thing we always talk about too when they come in. If it's particularly a lower body joint, well, anywhere, your feet are the basis of everything. So
it's interesting that you said about don't wear the shoes that are been a couple decades old. I still have some patients of mine that have some kind of signature sneakers from back in the 80s, and then they'll wear them, and then they'll finally start to run in them. Thinking about some old Jordans or whatever. But the technology has completely changed. So I go, what you were wearing back in the mid 80s is probably not the way to attack it today. But at least you're trying to attack it, but you might be injured at the same time.
Yeah.
Right.
So Dr. Artis, as people are trying to transition out of winter into a warmer climate, what are some of the things that you kind of advise people to do as they're making that transition? Obviously, I'm assuming you want to ease into it, but what's your kind of approach for people?
I agree with what you said. I think you need to start with an assessment, especially if you haven't been active. And the problem is during the winter, people hibernate, and then they go out and a family member talks them into a 5K. And next thing you know, you see they rolled an ankle or something like that. So my suggestion would be to stay active year-round first. That's when you go to the gym and maybe put the gym membership on hold in the summertime and enjoy more outside activities. But the one other thing I would say about the physical assessment is a functional exam to make sure you might have muscles that are weak that you don't even know are weak that actually support running or certain activities that you want to do. Maybe it's basketball or tennis or whatever. So just trying to find out what those weak muscles are with a professional so that you can strengthen them, and that can help go a long way in carrying you through preventing injuries.
Excellent. One of the things, as I'm a parent with 2 young kids, and they're now out of school, and I haven't gotten any new gray hair since that time, but we'll see what happens. But as my children have gotten out of school, of course, we want to encourage them to have healthy behaviors and keep them busy, which is a good thing for them because we want them to be exposed to a lot of stuff. I want to ask this next question, Dr. Burt. We live in a kind of a culture now where you're seeing kids as young as 4, 5, 6, 7 years old that are becoming specialists in one particular sport. And I could probably say, and for people that don't know, Dr. Burt actually played college basketball. Little side note. But when you think about kids now trying to be forced into becoming a specialist at a very young age, goes against everything that we kind of did when we were kids. So how do you what's kind of your approach when you see that kind of scenario of people going down one pathway? Maybe you might see more in the high school athlete when they really may get into some more injuries. But what's your approach from kind of doing that?
It's true, we're seeing that a lot more now, and it's unfortunate because the era of the multi-sport athlete is starting to fade a little bit, which is, as you said, something that we grew up with. And there is a lot of research coming out now that definitely shows the benefit from a physical standpoint and probably even from a psychological standpoint of continuing to be a multi-sport athlete. And in fact, there's evidence to show that participating in other sports can help you rise to a higher level in whatever your so-called chosen sport is, as opposed to what kids are doing now, which is focusing all their time on one sport. And I think that it's dangerous on many levels, but people get into a rut physically, they get into a rut psychologically, and then at the end of the day, they may not actually be advancing to the level that they really wanted to with whatever given sport that is. And we see it with all various sports: soccer, softball, basketball, volleyball, even football. You see kids just zeroing in on those sports, and they turn into year-round sports. So I definitely try to tell kids and their parents to number one, give themselves a break really from all organized sports for 2 to 3 months per year whenever possible, and to continue to participate in a variety of sports. I think it's just a lot more healthy from a musculoskeletal body standpoint and from a psychological standpoint. But you actually mentioned it, we really are seeing kids way too young that are subspecializing in those sports, 6, 7, 8 years old, and it's just really not a good thing for them in the long run.
Yeah, and I think about a lot of sometimes the entry point, even some of the coaches that are out there now might not even give your kid the time of day if they hadn't gone through X, Y, and Z within that same discipline. So it's actually become a very disheartening kind of thing, but that's how the cultures change. Hopefully, the culture won't stay like this, but you're absolutely right, the reality is that it's kind of fading away. Dr. Artis, from your perspective, what do you see, because you have a unique approach from a chiropractic perspective, but what's your take on the kind of the generational or the culture-based approach right now on having kids specialize at a very young age?
I think one of the things I see, at least the burnout faster. I've seen kids go all the way up to high school and they're really doing it for their parents. And then I see the lack of an equal muscle development. Like when they specialize, I see it a lot with hockey. That's kind of a year-round thing. I see it also with certain kids that play softball. That's a big one. Basketball. So I think you create a well-rounded athlete, and it gives that kid a break from that sport, so they can actually develop muscles all the way around that can better support them to do that. And I agree with what you were saying, Dr. Burke. I think that they do better if they play multi-sports. I came from the generation where, it was football season, basketball season, baseball, and then if you switch from soccer, if you didn't do one of those, they would say you play soccer to help you with your footwork with basketball, or, different things like that. So, I think they're at a huge disadvantage by just pushing the kids that way, and I think they should kind of force them to try different things because they might enjoy it better.
Natalie, what's your perspective? What kind of advice would you give to, you're seeing patients from all ages come through from a physical therapy standpoint, and you've seen, people that have had pretty significant injuries, and then on the other end, people that can kind of recover kind of faster.
Sure.
But did you ever give some advice out to the parents that bring their child in with an injury?
Yeah, a lot of time. We see the re-injuries, the sprains, the strains, the overuse of doing the same exercises. It's a common question. I think sometimes the parents push the kids back too soon because they want them back into that sport. And I think all of us would say, I've seen multiple times 11, 12-year-olds having re-ACL tears.
Oh, yeah.
Because maybe those hips weren't strengthened properly, especially girls. We're seeing a lot of girls, basketball, ACL tears on that age group. Hips weren't 100% strong again. They went back to playing that sport again. And here we go now, your hips are not strong enough, so you're taking that shock absorption back in those knees in the wrong spots, and we have injuries again. I can think of 3 or 4 kids right now. So it can be very hard. Sometimes these parents are very driven and want their kids to succeed, but are not thinking of long term. And a lot of the sports, if I ask the kids, are your coaches having you stretch? Do you guys do this type of stretch after? Are you doing this kind of strengthening after? No, we just do, 2 things. We just run around the gym and that's our warm-up. So there's a lot of components that are missing, and I think that's why we're seeing more and more injuries and more overuse, strains, sprains. And it just worries me, they're so little now, what happens when they're 30s, 40s, 50s, you know, so.
One plug I would make, speaking specifically of ACL tears and specifically in young females, is that young females and females in general are about 5 times at higher risk for ACL tear than males. There's a variety of biologic and physiologic reasons for that, but when you combine that natural predisposition with high level intensity year-round sports, and specifically soccer is a big offender, so to speak, in the world of ACL injury, that's a big problem. And many of the clubs, the travel clubs, do incorporate ACL prevention type of exercises into their normal workout routines and warm-ups, and whether or not the girls know that they're doing it. However, speaking of prevention, the best thing you can do if you have a young female athlete in whatever sport they may be participating in is to get with a good physical therapist like Natalie and get an ACL prevention assessment first, and let them do some dynamic testing with the young athlete and see where their deficiencies are, but then get into a very regimented ACL injury prevention program. And they have to dedicate extra time to it. I tell all the young kids that have either had injury or we're talking to them for other reasons, is that they have their sport and they have their exercise homework, and the two stay separate. If you don't do your homework, you can't persevere in your sport, and you're going to be at higher risk for injury. So they have to do that homework, and when it comes to ACL, there are a lot of good ACL prevention programs out there, but they have to get with a good physical therapist to get lined up in that.
I want to add one other thing too, if that's
Please.
okay. We were talking about this earlier too. The other prevention I would say is we don't live our lives in straight planes. So a lot of times these kids aren't strengthening in lateral or side movements, and that's soccer, that's basketball, so I also would say a great prevention is making sure you're strengthening in different planar directions to help cut down on some of these injuries as well. So
This is why I like having you guys on this panel, because as a primary care doctor that mainly sees adults, and I'm not necessarily privy to this kind of information when you're seeing it in the younger, as injuries tend to trend younger, things that I might see in an 18 or 20-year-old, you guys are seeing them at a much younger age. So as an internist who can really only see people 18 and up, with a very few exceptions, below 18, very few. But I still see this kind of stuff, so it's really interesting that I hear about the pulse of what you guys are seeing on a day-to-day basis, because next thing I know, if they had that history, then I see them when they finally graduate to adult medicine, I'm actually a little more aware of some of their background, and that history is super important. And I know it might be a little hard to explain some concepts to an 11-year-old or a 14-year-old, but certainly when somebody gets to 21, 25, or whatever, they can certainly understand the nuances of their body and understand the impact of their condition. It's so interesting that you said, you're seeing things that, I think when I was in high school, we might have seen somebody from basketball have an ACL, but it didn't seem like it seemed like it was far and few in between, and now you guys are saying it's really happening at a much younger age. Who would have thought the junior high population or younger? What's your take on that, Dr. Artis?
I think it's overuse, and that's why we need to do other sports. You need to participate in other activities. I see it a lot too. People that dance, ballet, ballerinas, jazz, stuff like that, overuse, and they just got to get back to produce for this show. And the joint hasn't recovered properly, so they end up damaging and causing more damage. So it's very important, man, that we just do more things and not isolate our kids to that one thing.
I think that for me as a parent, that's huge, and probably everybody else can comment on this one too. Being a parent, we try to keep our kids involved in a lot of different things, because why overburden that at this point? If your child's 6, why overburden that?
I was going to add to what John was saying too, that in addition to the variety of sports is that rest. And that's the hardest part these days that I see in the kind of sports medicine world. People are very hesitant to give their kids even a 3-week rest from an organized sport, much less a 3-month rest. And I think a minimum of 2 months is a great idea, whether that's consecutively or perhaps at different times during the year. Unfortunately, there's so much money involved in it now as well that becomes a confounding factor, because people have already paid for this tournament or that tournament or this upcoming season. And unfortunately, that starts to factor into people's decision making. Hopefully not as much, but it does.
Especially when you talk about the influence that some of the big corporations are doing and organize these tournaments, the AAUs, the Nikes, the Adidases. There's big money in that kind of thing. For the small chance that your child may even make it to play collegiate level of sports, and even a more infinitesimally smaller chance to make it into the professional leagues. At this point, I want to take a just quick break to just give another shout out to our sponsor today, Midwest Sports Medicine Institute. Whether competitive athlete or weekend warrior, you expect nothing but the best. Injury or chronic pain in the knee, shoulder, and other joints can be disabling and frustrating. At Midwest Sports Medicine Institute, we strive for excellence in the diagnosis, treatment, and follow-up care for your condition. If you have sustained an injury or are suffering with chronic pain, schedule a consultation with Dr. David Burt to take the first step toward relief and experience the latest advances in orthopedic and sports medicine treatment. Contact the practice today at area code 815-267-8825 or visit www.gomidwestsports.com. So what I want to do now is I want to transition a little bit to some of the lifestyle things. We've been talking about some of the kind of common injuries that we're seeing, and these injuries are real. And as we're talking about transitioning to summertime, as I said a little bit earlier, countdown to summertime equals countdown to healthy time. There's a lot of lifestyle components that are important as we engage in these behaviors. And at the end of the day, yes, we want to enjoy our summertime so we can enjoy times with our family and our loved ones and not be on the sidelines or not be at that summertime wedding that you're going to go to wearing a cast around your arm or a cast around your leg or walking in with a cane, or go to the tournament with your kid and you get rolled up in a wheelchair or something because you broke your leg or things like that, and hopefully to avoid, obviously, hospitalizations. So there's certainly a lifestyle recommendation, and some of the things that I think about, and I'm going to ask my panel to give me a little more of their insights. When I look at people, I say, okay, so of course I'm looking at it from the perspective of a primary care doctor, and primary care doctor prevention. So we talk about having a proper lifestyle. To piggyback on what Dr. Burt said, yeah, rest is a very important component when we talk about injury prevention, allowing the body to recover. Diet is an important thing. We know that when you prevent injury, we want to make sure that you're not having other confounding medical conditions. So I look at, as we keep the body moving, you can continue to lower blood glucose levels, you can continue to lower triglycerides, you can continue to lower cholesterol, and hopefully that translates, as you're metabolically healthier, you can translate into physical health. I think about kind of sleep. So I want to ask Natalie this question. Natalie, do you recommend a certain amount of hours of sleep for your patients that come in to recover?
Yeah, and
just throwing it out there.
Recover, yeah. Especially post-op patients, I think they get upset sometimes because they're not used to being so tired. So they'll come in for a 45-minute session and be so upset at the end of the session how tired they are. But they don't realize that when you sleep, your body is healing. So I tell them, don't be upset. This was only to help you. Stay positive. You did this so that you could move forward and do the things you want to do. So in those instances, sleep as much as you want when you're recovering. But everybody should be getting, what do they say, 8 to 8 hours.
We usually recommend in primary care 7 to 9. If you get 8, that's great. Most of us in reality, as busy professionals, we're probably just really bringing up the rear end on that one as far as lack of sleep.
But I think healing I think needs more sleep, and they need to realize that when you're recovering, you need to rest. And and when you have an inflammatory something going on, so a sprained ankle or whatnot, and you keep pushing through it and you don't rest, you start to get changes in those tendons. They thicken, they change. You start compensating other joints. So rest. It's rest. Let your body heal. Whatever's going on, surgery or not.
Excellent, Dr. Artis. What's your take on on stress management while you're recovering? Is there a role of that?
Oh yeah.
Please go ahead and elaborate if you can.
The thing I see the most is people, they don't sleep enough. And I can be guilty of that myself. But I think when you're healing, it's a very key component that you get the right amount of rest and sleep, but also not too much. I think it's a combination between the right amount of movement and rest to help assist in that recovery. That's what I see where people slack the most. Either they get too much rest, or they don't do enough movement, or they get too much movement and not enough rest. So it's just, for that person, you got to find the right balance. And when you find the right balance, they're going to heal faster. And getting people to understand that is the key.
Excellent. Dr. Burt, for those of us that don't know, I've actually done some health screenings with Dr. Burt it's been a while. It's been a while since
Yeah.
we've done one of those things, but for a couple of years in a row, I was doing collaborating with Dr. Burt, doing some high school physical exams
Right.
for sports clearance through the state of Illinois at Plainfield North High School, and so we would see some of the kids come through, and Dr. Burt would assess them from a mechanical perspective, and I put my stethoscope on and listen to the heart and the lungs and get a little bit of medical history. But so certainly when you're involved with looking at high school kids, they're playing sports and everything like that, what's your take on water? Because some people will say a water intake may be a little bit of a myth, or you talk about dehydration, or is there anything that you advise people, even if you can even maybe expand on water, not just to say like, what's your take on recovery beverages that you're doing on the sidelines? What's your take on that?
Well, I mean, I think water is the easiest and most simple in being sort of pre-hydrated before your workouts, and if needed, staying hydrated during the workouts or games or whatever sport that may be, especially in the summertime. And football is one of the biggest issues there, or any of the other summer sports that are or practices happening during the summer. But recovery drinks, I think, are fine as long as you're not overdoing it. You don't want to just be going for some sort of sugar high on a recovery drink, after your workout. I think done in moderation, it's perfectly fine. I don't think it's absolutely necessary. I think sticking with water at the appropriate levels is fine. Certainly, we all understand medically you don't want to overdo water. That can alter your physiology in a bad way, and you can certainly even get very sick from drinking too much water. But staying at the appropriate level is fine. I do think that most of the coaches these days at the high school level are pretty aware of that and doing a good job, and the athletic trainers are doing a good job with that. But it needs to be continually harped on, and people need to be reminded about that.
Excellent. One of the things that I ask, and people may ask you from a primary care perspective, is, all right, Dr. G, okay, I'm ready, you've checked me out, I'm healthy, my labs are good, and I want to engage in some exercise, I don't want to get injured. And they ask me actually that water question quite a bit. And I usually kind of say, to make a short point, to make a quick point about this, I always say, hey, if your body's thirsty, drink. Water is very sufficient to help hydrate you, even if you're doing mild to moderate activity. Now, if you're doing something that's super excessive and vigorous, and for something prolonged, you may want to actually do some sort of recovery beverage. But then sometimes I tell people at the same time, I say, well, if you're going to do some sort of concoction that you're going to make, and that person may be trying to lose weight, and I say the last thing you want to do is, as you just exercise, you just burn just sugar in your muscles. You didn't get to the fat yet. That's the first thing you utilize. And then they might do a high caloric recovery beverage, and they say, oh, Dr. G, I'm not losing no weight. I'm not losing any weight. And I go, well, it's still calories at the end of the day. But I usually tell people water is very much sufficient, as you said. What's your take on hydration, Dr. Artis, what you see from a chiropractic?
I think it's very important for preventing cramping and just to help to speed up the recovery process. But even with people that aren't hurt, to prevent injuries, I think if you've got the proper hydration, which I equivalent to half of your body weight in amounts of water, because it's different for everybody, it can help you to just get through it. I know personally when I run, I'm a runner, if I don't drink enough water, I notice it. Especially you get past the second or third mile where you're getting into like over 20, 30 minutes of exercise and you're sweating. The more you sweat, I think the more water you need to drink to replace that.
Oh,
and it kind of keeps the proper balance of electrolytes and sodium, potassium. You can get real detailed with that stuff, but the point is, I think, is just to drink water. And as much as people, they don't like to drink water, they'll drink these sugary drinks like you say, and that causes more problems. So water is just the best thing out there.
Yeah, we are mainly water as human beings. I don't know the exact percentage, but I'm going to render it's about 7% physiologically we're water. And so yes, do it. A lot of times people say, oh, I don't like drinking water. And then I say, well, squirt a little bit of some little flavor in there, just a little bit, and make it a little more palatable, but we've got to do it. So let me ask this question for Dr. Burt. Some people tend to delay much needed surgeries until the summertime. So we see that quite a bit, maybe our teaching population or whatnot, but some people may tend to delay their much needed surgeries, like a meniscus repair, or rotator cuff repair, or various scopes until the summertime. But you might be seeing them in winter, and they're placing themselves at harm. So how do you maybe what are some of the reasons why people may delay in seeking proper treatment from your perspective?
I mean, most of the time it's logistical, like you mentioned, a teacher that just can't get off work till the summer, or any other type of employment where they can't afford to be off for any length of time. I think it depends on what it is. You know, most of the arthritic type of problems, so an arthritic knee or shoulder, those are usually pretty safe to wait, and it just depends on how they're doing from a symptom standpoint. When you've got a torn meniscus in your knee, or like you mentioned, a torn rotator cuff in your shoulder, those are things that potentially are going to get worse during that waiting period time. And so you have to weigh that against what's going on with the patient's life and work and logistics and family. And I try to encourage people in those particular situations to get it done sooner than later. But at the end of the day, these are not life-threatening issues, and so you have to work with the patient and see what works best for them. The last thing you want to do is rush into it and give the patient a secondary stress of the surgery plus doing it at a time that's not convenient for them. So you have to strike a balance with that.
Natalie, how do you deal with those kind of patients? Because you may see, and there may be some people out there listening right now or watching us, that they've got an ongoing injury. They know that their solution is probably going to be surgery. How do you manage that person? Because they might be coming in, and you even know yourself, hey, this is likely a surgical case. How do you manage that?
No, I think for us, it's the level of function. So if they're sitting on the sideline now, summer has started, and they can't do what they want to do, then it's time, right? And to kind of add to that other point, I think the reason in our world where we see certain total knees and hips being done in summer versus winter is the age group. So the more of the elderly group is going to do it now because they are at a higher risk of falling in those winter months, and they're nervous about that. So they'll come in the summer and do those. So we see that this is our time right now. But yeah, just having, I think when they can't do what they physically want to do, and they are active prior, and now this is taking them out of life, I'm very honest with them and say then it's time. It has to be their decision, and we can strengthen to a certain point. If they just can't function and we're plateauing in PT, then it's time, so.
And Dr. Artis, from your end, from a chiropractic perspective, yeah, you're trying to obviously deal with patients that come in and help them manage their conditions as well too. But I probably imagine you've seen some cases where you say, you know what, I've tried to do all I can from a chiropractic standpoint. This is legitimately a surgical case. But talk about a little bit about some of the things that you can do from your end that might be able to help. And it might be depending on the condition that we're dealing with, but generally speaking, things that you might be able to do from your end, from a chiropractic, to hopefully help preserve function and maybe delay a surgery, even though the surgery may have to happen down the road.
The key things that I focus on the most is, number one, is reducing the amount of inflammation. I think that's a key component to reducing pain, which is the biggest motivator for most people to have surgeries. I think that would change the time frame very quickly.
Yes.
And then the other component I would do is just strengthening the joint. A lot of times the joint is damaged because the muscles around or the ligaments aren't strong enough to support it. And if we can do whatever we can to salvage the muscles and strengthen the muscles to take place of the ligaments, or help strengthen the aid in that healing process, they'll get some relief. But at some point, I've reached patients have reached MMI, maximum medical improvement. And you know what, the best thing for you to do is this. Or people come into me and they might say, Doc, what can you do to help me? And I was like, you know what, I really not much I could do at this point, but what you need to do is get an orthopedic surgeon to assess it, and then maybe a candidate for surgery, let them make that decision, and then come back and we can help rehab that joint.
Right.
And that usually works very well. I've had a great success doing it that way. Because you can kind of get people to kind of put stuff off as long as you can, but at some point they're going to plateau. And it's just recognizing that before it happens and getting them in the right hands. It's always what's best for the patient.
Excellent. Well, one of the things that I think about when we're dealing with a lot of stuff is when do you kind of make that judgment call? And certainly from my perspective as a primary care doctor, I'm trying to direct people to resources as you guys are certainly resources here. And sometimes that can be a challenging thing for me, and I'll be the first one to admit it. But we know that as we continue to collaborate together, that we're all trying to serve the best interest for our patients. And it really turns out that the old saying, it takes a village, it really is like that in healthcare this day and age. We've gotten I used to see Dr. Burt and I used to see each other in physician's lounge all the time, and then I made a transition just to do outpatient medicine a number of years ago, but we kind of lose that collegiality, and we become kind of siloed. Even the patients that I might send over to Natalie's way, I would say, here I am in one town, and then I want you to go across town with your injury, by the way, that you might not be able to make it, and then potentially, hopefully you're not climbing any stairs or the elevator's not broken that day, and try to get up to second or third floor. Same thing like Dr. Burt. But what are your kind of things? I'll ask this question to Natalie. How can we make things better? How can we streamline communication amongst the multidisciplinary approach?
Yeah, I think right now we have a good little thing going even with the system we have through Edward. It's allowed us to be able to see all the physician's notes, but I'm still old school, get on the phone, make that phone call if I need to that doctor or, primary or surgeon, or if I have any questions, and the patients appreciate that when you work as a team. We get to see patients twice a week for 45 minutes. Our docs, your patients are sitting when you see them, right? You get, a shorter time. So a lot of times we get to see or pick up on a few other things that will only help. We're all working for the same reason. We're all working to better that patient. So a lot of times I'll call the doc and say, hey, I've noticed this, or I've noticed that. And so I think, and the patients truly do appreciate that. They think they're, you talked to him, so.
Yes, I got a cell phone right here.
Yeah. So our technology has helped a lot, but yeah, just making that phone call or sending a little email and then getting back to the patient, or the doctor calls back the patient. So I think just staying in touch with everyone.
I think some repetition, like Natalie's mentioning, is important, because we probably don't see them as often as physical therapy does. And so if they're picking up on something that we didn't pick up the maybe one and only time we saw that patient, then that's very useful information, and that potentially could completely change the direction of the treatment. And that happens sometimes even if we're seeing, I might see a patient last week and I see them 3 weeks from now, and I might be getting a completely different feeling or story from that patient by continuing to listen to them. And that could really, change the direction of what you're doing, and hopefully in the right direction for their benefit. But yeah, having open lines of communication amongst us is very, very important, and with the patient as well, and letting them know that we're communicating also gives them reassurance.
Yeah, it's definitely a team effort, regardless of condition. But certainly, as we're talking about people, having just one body to be in, and we want to maximize our bodies, our functioning. So super, super important. I want to kind of tell the people that are listening to the show or watching us on Facebook Live is that you will always have people like me and people like my panel today that are going to advocate for you. So I always say, never forget that it's okay to ask a question. It's okay to reach out, and it's okay for as a physician from my end, it's okay for me to say I don't know, but I can get you to somebody who does know. And it really helps to streamline the care and makes it a lot more seamless. And so we always kind of say, I had a guest on the show not too long ago that said, check your ego at the door, and we're all on this together. So that's very important. A couple of questions I just want to ask real quick. There's an interesting thing as I'm researching this topic, and I kind of wrote couple notes down here, but I want to ask this to the panel, so I'll start with Dr. Artis on his thoughts. But it gets brought up to me a lot. Do you exercise in the morning, or do you exercise in the evening? Is there a difference? I kind of tell people, I say, I need you to be moving, but I want to ask Dr. Artis first on his kind of thoughts on that. What do you advise your patients?
I think it depends on the person. It strongly depends on the person. What I recommend is routine, though. I think the body works better when we work out at the same time. I just happen to be a morning person, as a lot of people do, but you got some people that are the evening people. They prefer to work out after work, and you got some people that do it midday in between their lunch breaks and stuff like that. But it just depends on the person. It really depends on the person. The key is consistency and that repetition. That's when you'll get the better results.
Natalie, what are your thoughts on that?
Well, I set my alarm clock every morning to get up at 6:30 to walk downstairs and go on that treadmill. I am a nighttime workout person, so I agree completely. Yes. It has to be. I always have the intention the night before, but I tell it the same thing. I agree. It depends on the person. Now, they say sometimes in the morning, you guys may be able to answer more to this, that if you do it first thing in the morning when you haven't eaten, if you're going for weight loss, that you're going to burn those calories quicker. I don't know how, that's not my expertise. But, no, I think it just depends on if you can get it in the day at some point. but do when you're comfortable. If you try to do it in the morning just to do the exercise, you may not be doing a true, level of performance for yourself. You're just doing it to get it out of the way. Then don't do that. Wait till you feel you have the energy to do the exercise. So,
Dr. Burt, do you advise your patients anything about AM or PM, or does it really matter to you?
No, I agree with what Natalie said and with what John said, is that it has to be qualitatively best for you. So it doesn't make any sense to get up at 4 in the morning to knock out a workout if that workout at 4 in the morning is low quality. Then I think you're just wasting your time. So you have to pick a time of day that you feel like you have reasonably good energy and you can put some effort into it. I think you'll get most out of it then.
Yeah, I always tell my patients, yes, have a routine. You want to cultivate the consistency aspect, and you want to be intentional too. Whatever your goals are, you can make it personalized to yourself. I just want people to be moving, and exercise, of course, has so many connotations to it because you think, oh my goodness, I need to just run 5 miles. I need to lift weights for an hour. You can make it personal, and that's the beauty of it. However you want to do, whatever your goals are. But we do say, certainly from a physiologic standpoint, from a medicine standpoint, and a medical doctor, I say yes, there are some benefits out there, certainly when we're looking at the rising chronic disease burden in this country. So we talk about, yes, we want you to have lower blood sugar levels. We want you to have lower cholesterol levels. We want you to have lower triglyceride levels. We want you to maintain a healthy weight and not deal with some of the challenges of obesity. We want you to not have high blood pressure. We want to get into the prevention, which is the why I've gone into primary care in the beginning. So what I want to do, we've got a few minutes left, and I kind of want to, when I kind of wrap up each show, I always like to call this the assessment and plan section. And kind of like in medicine, when we see people coming into our office, we see them for a chief complaint, and then eventually after we do our examination, we do an assessment and plan. So as we kind of do an assessment and plan of this issue, I'm going to start with Dr. Artis. Dr. Artis, give me kind of your 3 takeaway home points when you think about preventing injury.
Number one thing I would say is warm the muscles up that you're going to use for that activity. And if you don't know, you need to ask a professional, number one. So say if I'm going to run, I'm going to properly warm up the muscles that I use mainly for running. I'm not going to do a lot of chest, stuff like that, more the legs, the hamstrings, calves. I would say cool down. That helps in the recovery process. I mean, stretching, make sure you're hydrated, and more so dynamic and a little bit of static stretching. Dynamic is more like where you're moving in motion, and static is more where you're just holding a position for a certain amount of time. Those combinations, they heal better. And then also get assessed with your biomechanics. So if you're looking at that, say, hey, look at how I run, and tell me if I'm doing it right. Look at how I do this. Because you see some people, their intentions are all well, but they're actually causing more harm than they are good. And that's one of the things that we strive to help prevent.
Excellent. Natalie, what are your kind of take-home points on today's topic, and how can consumers be more successful when it comes to preventing injury?
I would say definitely body mechanics. So as we get out there and you start doing some weekend warrior projects or getting going with some of that type of stuff, don't be in a rush all the time. Stop and think. Don't try to lift too much at one point, time. Just always think, where is your body? Where's my body? Is the objects close to my center? My second would be to make some attainable goals this summer. So no matter what your level of performance is, set yourself some goals that you're going to increase the distance of how far you walk, swim, bike. You're going to increase the time and monitor your heart rate so that, maybe initially it just jumps up, and you're going to monitor that over the summer and try to get that at a good level. And then my third would be throw away the flip-flops. No flip-flops this summer.
No flip-flops.
You know which ones I'm talking about.
Shoes.
Yes. You're asking for trouble.
That's excellent. Dr. Burt, a couple take-home points from your perspective?
I would say for the young athletes, the number one thing is get involved in multiple sports and give yourself rest. 1 to 2 months a year, stay away from organized sports for at least that amount of time. And that, I think, alone can help prevent a lot of injuries in young athletes. For adults, if you're embarking on a new program, get over to Dr. Gomez first for a good medical evaluation to make sure that you're medically and physiologically fit and safe to undergo exercise. And then when you're free and clear to do that, start slow, stay low impact, and try to incorporate some gentle resistance strength training as opposed to just going all for cardio.
Excellent. And my kind of take-home points are really centers around, number one, get an assessment. As a primary care doctor, I want people to come in and see me. Let's just make sure you're doing all right. And once we establish that the body's doing all right, physiologically, yes, we want you to get moving. And I want people to get moving and just be blessed that you have passion. You can move with passion, you can move with purpose, and little things do count. To going from just taking the stairs or parking a little bit further away or just getting outside with your family and your loved ones, walking around the neighborhood. There's so many ways we can engage in healthy behaviors. As I said, countdown to summertime equals countdown to healthier time. So with that being said, I want to thank my guest, Dr. David Burt, founder and owner, board certified orthopedic surgeon at Midwest Sports Medicine, Ms. Natalie Florio, physical therapist with Edward Elmer's Healthcare, Dr. John Artis, board certified chiropractic physician, co-founder of Health on Earth Wellness Centers. I want to thank my platinum level sponsor, Midwest Sports Medicine. Check them out, www.gomidwestsports.com. You can always follow me on Facebook, Instagram, and Twitter at To Your Health Dr. G, or visit me on my website, www.drmarkgomez.com. Next week, we're going to be continuing the Summer Countdown Series, Part 2, Asthma and Allergy. Take care, everybody. God bless. Peace out. Bye-bye.